The broadcast is now starting. All attendees are in listen-only mode.
Hello, welcome to today's webinar. This is Ann Potempa with the Alaska section of Chronic Disease Prevention and Health Promotion. Welcome to our webinar series. We're excited today to share the new division with the new unit with the Alaska Division of Public Health called the Healthy Equitable Communities Unit, and we will be sharing that with you in a minute. I'm just going to go over a little housekeeping items with you. Audio will be coming through your computer. Another option was to call into the number provided when you registered for today's session. We will be holding all questions until the end. That said, if you do have a question that relates to an inability to see or hear, please let us know right away by typing that into the chat box in the control panel. I'm now going to introduce our speakers today, Maria Caruso and Addy Peters with our new unit. Thank you so much, Maria.
Thanks so much. Hello and welcome everyone. My name is Maria Caruso and I'm the Community Engagement Coordinator with the Healthy and Equitable Communities Unit, and I am based out of Anchorage.
Thanks, Maria. Welcome everybody. My name is Addy Peters and I'm the Community Coordinator based in Bethel with the Healthy and Equitable Communities Unit. Next slide.
We also have with us Terry Keklak, who is our team manager, and Krista Phelps, who's our nurse consultant, and they'll be able to help us answer questions at the end of the presentation. When we think and act upstream, we can create a healthier and more just world. This sentiment encompasses the work and goals of our team. Next slide. When we think of moving upstream, we are looking at factors that support good health through measures such as access to healthy food, quality healthcare, transportation, housing, and economic stability, to name a few. Our community and the areas where we live, work, and play have a significant impact on our personal health. By taking a more holistic approach and maximizing opportunities to live healthy lives, we end up decreasing or even preventing many ailments or influences that may lead to illness. For example, later in this presentation, you'll hear about a playground project, which increases opportunities for children to be active and socialize. Giving children access to safe environments in which to play not only creates a fun space, but can impact childhood obesity, academic performance, and assist them with developing social skills. Next slide. The vision of our team is for all Alaskans to have equitable access to opportunities to lead healthy lives. Our mission is to partner with Alaskan communities to improve conditions that support health and well-being, prioritizing community members who face significant barriers to better health. Next slide. So what do we actually mean when we use the term equitable? For us, it means that everyone has fair and just opportunities to be as healthy as possible. Equity means that we all have the resources, services, and support that we need, no matter who we are, where we live, or what we look like. It essentially means health for all. All of our communities in the state look a little different and have different strengths and challenges. For example, the price of fuel has risen significantly in recent months. Rural areas are particularly impacted by the increase in price and shipping costs. In partnership with local tribal governments, we have been able to assist in providing gas vouchers to community members. This can be used to increase food security because using boats and four-wheelers are an essential part of living a subsistence lifestyle and provide better access to fishing and hunting. Increasing access to telehealth is another example of improving overall health. The need for expanded telehealth services has been highlighted by the pandemic. For individuals who are immune compromised or for those who live in rural areas or don't have easy access to a provider, telehealth offers a safe and simple way to access care. Through partnering with the local government in Palmer, we are working to improve broadband access, specifically to expand telehealth infrastructure. The city is also purchasing iPads, which will be available in public locations for community members to check out for telehealth appointments. These are some specific examples of what we mean when we say we are working to provide better health opportunities for Alaskans across the state. Next slide.
I'd like to share a little bit about our story so you know how and why our unit was started. The unit was established in 2021 in response to the widening health disparities highlighted by the COVID-19 pandemic. According to a report published in the ADM, as of September 2021, Alaska Native people make up just 16% of the state's total population, but had accounted for 29% of COVID-19 deaths and a quarter of virus-related hospitalizations. Our unit focuses on creating partnerships across Alaska to ensure that the conditions in which Alaskans live, work, and play better support opportunities for all to lead healthier lives. For example, during the height of the pandemic, some people who are visually impaired had a hard time getting COVID-19 testing. The Healthy and Equitable Communities Unit was able to collaborate with a contractor to facilitate improved access to testing for this population. We are focused on serving local communities and to being guided by them as well. This is done through a variety of different means. We have staff placed in various public health centres around the state. Our strategic plan was developed with the support of communities, and we have just recruited and selected a community advisory committee. Next slide, please. Our team is funded by a CDC grant through at least May of 2023, and the focus is on addressing social factors that impact health on a broad level, such as increasing opportunities for Alaskans to translate health information into local languages. In Bristol Bay, video remote interpretation was used at the airport and ferry terminal to provide information on COVID-19 to a diverse group of fishery workers who truly come from all over the world. But COVID-19 is just the starting point for our team. Our unit seeks to expand its reach and to widen our efforts to include the Healthy Alaskan 2030 goals, which is the state's overall health improvement plan. Next slide, please. This slide shows our organizational chart. The unit is under the division of the Public Health Director's Office and the leadership of Terry O'Connor. It is comprised of health professionals with a variety of backgrounds and areas of expertise. Some of our staff, such as health advisors and the policy coordinator, have a statewide focus, while others, such as myself, work in local communities in places like Bethel, Ketchikan, Kenai, and Fairbanks. We are still in the process of finalizing our team, and so we anticipate some changes to this chart over the coming months. And next slide, please.
Currently, our team is supporting numerous different projects across the state, each of which falls under one of these 5 different strategies. Next slide. We'll begin with strategy 1. This focuses on expanding or developing services to prevent and mitigate COVID-19 among high-risk, underserved groups. Some examples of how we have been supporting this include providing funding to the section of public health nursing. Public health nursing has worked tirelessly to provide contact tracing and case investigation services throughout the pandemic. Our team continues to support their efforts as they shift their focus to cluster outbreaks and high-risk congregate settings in future planning. Next slide. Another project we are supporting in this strategy is the development of an electronic referral system to address social drivers of health. This is a pilot project being conducted in the Mat-Su Valley in collaboration with the State of Alaska Health Systems Collaboration Team. The project focuses on connecting individuals who access the emergency room with other needed services, such as the tobacco quit line, food resources, and housing support. The Health Equity Funding Matrix is a project that will help our team and other sections in the division to identify where the greatest needs are located around the state based on social drivers you might not immediately think of, such as access to sewer and water infrastructure, or better access to public transportation for individuals with disabilities. Next slide. Strategy 2 focuses on improving data. We are working to ensure that data is equity-centered, easily understandable, and is accessible to all people in the state to help them make better informed healthcare decisions. Why is data such an important focus of our grant activities? Public health data is critical for many reasons and can be used in a variety of ways. Data helps us better understand what is happening in different communities and what the needs and gaps in service are. It can help determine what specific barriers are in a community and what public health interventions are most successful in targeting specific areas of need. Data can be used to provide evidence Sorry, I think I was just muted. Several of the projects that fall under this strategy focus on building our internal capacity by hiring additional staff who will be responsible for presenting our work and our data in a way that it is easily accessible and relevant to communities that might want to use it for decision making. Next slide.
And I think the next slide again. I think Maria has covered this already. Yeah, thanks, Maria. All right, so with strategy 3 then, we aim to build, to leverage, and to expand infrastructure support for populations that are underserved. The first steps taken to begin this work under the CDC grant were, of course, to hire our team to support the many activities laid out in our work plan and to begin work on the strategic plan. External partners that provided input on this plan included private businesses, nonprofits, philanthropy groups, and local governments, in addition to others. If you don't already have a copy of our strategic plan, it is available on the state website. Next slide, please. Another project that falls under this strategy is to assess our current hiring practices through an equity lens and to enhance our ability to create a diverse and inclusive workforce to serve in state government. We are also collaborating with the section of Public Health Nursing to support a public health residency program for newer staff. This program is already underway, with the first cohort having started in January of 2022 with 8 participants from around the state. Residents learn a variety of information on topics such as neighbourhoods and health, health equity, and health in all policies. Next slide, please. Because we know that communities are the experts in their own strengths and needs, our 4th strategy focuses on working with statewide, regional, and community partners and prioritizes building and strengthening initiatives that are already underway in our state. Next slide. Accumulated public health knowledge tells us that emergency services are often used to access a wide variety of needs beyond the immediate presenting problem. We also know that local engagement with and ownership of research and data is vital for meaningful and sustainable change. For these reasons, we will put resources towards the projects on this slide, such as expansion of EMS services, and the piloting of a Communities That Cares approach to selecting evidence-based prevention programs in local communities. Next slide. Here are more examples of ways we engage in collaborative work and ensure that we are reaching the greatest number of communities and community members possible. Next slide.
Our unit supports the Division of Public Health by emphasizing the need to view services and programs through a health equity lens and spearheading projects that support this goal. Currently, we are working on reviewing state processes for hiring, as well as analyzing the way we award grants and contracts to ensure that staff and programs reflect the cultural representation of our communities, and that the division has input from a diverse array of consultants and contractors to guide our work. With data, we are promoting best practices for improving coordinated collection, analysis, and dissemination, and including input from populations served or affected. We are working to ensure that continued COVID-19 mitigation efforts include the most vulnerable populations. We are providing funding and partnerships with a focus on ensuring that funds are directed at identified barriers and are fair in supporting all populations to achieve their full health potential. We have developed a policy to guide the activities of the division as well as our unit. We also will be analyzing proposed legislation that affects the Department of Health and Social Services. In partnership with the University of Alaska Anchorage, we are working to develop training which will be available to all members of Alaska's public health workforce and are supporting improvement of community education materials by including plain language, audiovisual, and other multi-language approaches. Next slide.
Of course, what works in one Alaskan community may not work in another. This is why we have local community coordinators located in several of our public health centres around the state. These community coordinators are working at a local and a regional level to tackle inequities and ultimately to build healthier, more connected communities. Project examples include facility and infrastructure projects and improvements, support of regional advisory groups, outdoor mobile sports programs and playground equipment, translation of educational materials, and more. Next slide. Next slide, thanks. So let's focus in for a moment. Did you know that about 1 out of 3 Alaskan children are growing up currently overweight or obese? Just one way we can help kids grow up at a healthy weight is encouraging them to play every day. In fact, the state has a campaign with this very name. Ideally, children and adolescents should engage in physical activity for 60 minutes a day. Next slide. Indeed, COVID has highlighted the importance of outdoor recreation opportunities in all communities. To help families increase their physical activity, in Bethel, Healthy and Equitable Communities funds are being used towards new playground equipment that will increase access to fun and free community spaces for children and youth, promoting health, physical activity, and simply positive human interaction. In Bethel, the city even got the kids involved in deciding where the new playground equipment should be installed. Next slide. In summary, our Healthy and Equitable Communities unit uses upstream strategies in collaboration with community partners to maximize health for all Alaskans. Next slide, please. So just so you see here, here's our contact information for Maria and for myself, as well as the general phone number, email, and address for our unit. So that's there for you. Thank you. And next slide has our references and resources, please. So if you're interested in exploring some of what you heard today, these are our references and resources. As soon as we have our Healthy and Equitable Communities webpage, we'll make sure that that's available to you also. And last slide, I think, please. Right, so thank you all for attending, for your time and attention. Thank you to Anne and Julie and Chronic Disease Prevention and Health Promotion for inviting us to present today. And we'd like to turn it over for questions.
This is Anne again with the section of Chronic Disease Prevention and Health Promotion. Thank you so much to Maria and Addy. We have huge interest in today's webinar with about 125 people listening in. So thank you so much for having given their time today. Arthur is helping me look for questions. Arthur, do we have any questions in yet for our panelists?
Yes, we do. The first one is, are all rural communities able to get gas vouchers? If so, where do they get them from?
That is a great question. We had a round of funding through a memorandum of agreement program that was released last fall. All communities were eligible to apply, and that is where they got funding for that program. And we are anticipating having another round of funding in the coming months. So once that information is released, then we would absolutely love to see applications from all the communities that we can to help facilitate that partnership.
We have another question. Mary says, thank you for the wonderful presentation. How were community advisory board members chosen?
Good afternoon. This is Terry Keklak, and I could answer that question. We had applications that we had out on our website and on Healthy Alaskans 2030. We received applicants to participate on the Healthy and Equitable Communities team, as well as on the advisory committee for Healthy Alaskans 2030. We had only several applicants that we didn't offer positions to on our committee. Basically, the folks that didn't get selected sent in their applications beyond the deadline. However, the application process will remain open, and we will accept applications in case there is a vacancy or when we are filling the team in another 2 years. Thank you.
And then we have another one. It's she is interested to know more about the community coordinator. So is there a place where she can find out more information about that?
Do you want to take that, Maria?
Sure, yeah. At the moment, we are working on getting our website together. So we're hoping to have that up and running soon. And then we anticipate having all of our information listed there. In the meantime, feel free to email us, either Addy or myself, or at our team email that was listed in the presentation. If you have individual questions, we can help answer or connect you with local coordinators.
Sure. And I guess I would just add to that, at the moment, we do have community coordinators, and if I'm missing anywhere, let me know, in Fairbanks, Ketchikan, Kenai, and Bethel. And we have community coordinators about to start in the next weeks or months in both Homer and Nome, and possibly in a couple of other areas as well. But that's where we currently have community coordinators.
Could you say a bit more about the PHN residency program? How long is it? Who's eligible to participate? And are there current PHN openings, or is it part of a succession planning?
I can answer that one. This is Krista Phelps, the nurse consultant with the group. So the nursing public health residency, it started in January. And there are currently over about 20, or at least when they started it, there were over 20 new public health nurses that were participating. The program runs for about 12 months, and it includes monthly sessions that are partially asynchronous, and then there are synchronous sessions that are led by people here in the state to kind of give the curriculum an Alaskan spin. And then there also are mentoring opportunities for those who are new. The program is designed for people who have started working in public health within the last year. So this is the first cohort, and we anticipate having future cohorts as well, depending on the feedback that we get from the group and how we want to move forward. But we do anticipate having another cohort coming up. Thank you.
How are you working with other programs within Department of Public Health that work on health equity activities to avoid duplication / overlap of efforts and capitalize on existing work and institutional knowledge?
Hi, this is Terry, and I'll take the first stab at that. And we are doing several things to work within the Division of Public Health. The webinar that we gave today was actually established to ensure that our partners in public health would understand the work that we're doing. And we are also working with them to understand the programs and the work that they're doing out in the communities or within public health, sharing information, sharing webinars, attending their staff meetings. Our staff, like Addy and other of the community partners, are housed in the public health center, so they work directly day to day with public health nursing out in the communities on those efforts. And folks in other public health sections are always invited to participate in any of the work that we're doing. Thank you.
At what levels of the state health department do you coordinate?
Within public health, I would say that we coordinate at all levels, from leadership with Dr. Zink, with our director, deputy directors, with the other section heads, and with staff that are working in the communities and on the ground.
Thank you, Arthur. We have time for probably one or two more questions. And then as a reminder, the recording and the presentation will be mailed out in the next couple of weeks to all registrants, whether you were able to attend today or not. So we look forward to sharing this with you in another way. Arthur, anything else come through in terms of questions?
No, not at this time.
All right, thank you so much, Maria, Krista, Addy, Terry. We really appreciate you sharing this new unit with everybody on the webinar today. It's incredibly important information to share, and we thank you so much for your time. Thank you,
Anne.
Thank you so much.
Thank you, everybody.